Hi, my name is Dr. Rebecca Dale from Arbor Eyecare. I'd like to share some information with you about one of my favorite subjects, cataract surgery. First, let's take a look at the parts of the eye. We've got the cornea, which is the clear window on the front of the eye. The iris, the colored part of the eye, is behind that, and behind that is the lens. The curvature of the lens and the curvature of the cornea work together to focus light onto the retina. When we're young, the lens in our eye is transparent. It's clear and flexible. That means that we can flex a muscle to change the shape of the lens so we can shift our focus from objects that are far away to objects that are close up, and we do this without thinking. As we hit our 40s, the lens starts to become stiff, and that's why we have bifocals, trifocals, and progressive lenses, because the lens can no longer shift from distance to near. As time passes, the lens begins to become opaque. When the lens is opaque, kind of like looking through a dirty window, the light may scatter or images may look blurred. There are different types of cataracts. A nuclear cataract is most commonly associated with aging and happens slowly over years. Other types of cataracts include cortical cataracts and posterior subcapsular cataracts. The names don't really matter. They are all treated the same way, removing the cloudy lens and replacing it with a new biocompatible plastic lens. Cataract surgery begins by making very small incisions in the cornea, the clear window on the front of the eye, where we pass tiny instruments to do our work. We make an opening in the little sac that holds the natural lens called the capsule. That sac is suspended from the wall of the eye by tiny fibers. Imagine removing the chocolate from the inside of an M&M. That's essentially the same idea with cataract surgery. We're making an opening in the candy shell, taking out all of the chocolate, and putting a new lens in its place. However, unlike a candy shell, the lens capsule is very thin and flexible. In some places, it's thinner than a human hair. After making an opening in the capsule, we then break up the cloudy lens and vacuum it out. Cataract surgery generally takes about 10 to 15 minutes. During the procedure, our goal is for you to be awake but relaxed with light sedation. And don't worry, you can't see what we're doing. If you need both eyes operated on, usually this is done 1 to 2 weeks apart. You will be using prescription eye drops starting just before and for a few weeks after the procedure. After the cloudy natural lens, the cataract, has been removed, we'll put a new lens into the sac that used to hold the natural lens. That new lens will stay with you for the rest of your life. That's the basics of cataract surgery, but there's a lot more information to know. Please see my other videos to learn more.